Good morning and good afternoon. Thank you all for joining us. On behalf of Becker's, on behalf of Clearway Health, we're grateful that you've chosen to join and spend time with us today. I am Allison Arant. I am Senior Vice President at Clearway Health, and I'm honored and excited to have two of our client partners joining us today. We have Lurie Children's Hospital in Chicago, Illinois, and Children's National Hospital in Washington, D.C. We have partnered with these organizations for a few months and a few years, respectively, and we're excited that they're here to share some of their stories and experiences as we think about ways that pediatric hospitals can innovate and use specialty pharmacy as a way to grow their organizations to serve their patients and their communities. I'm excited to introduce the panel to you. Rich joins us from Lurie Children's Hospital as the Chief Strategy Officer, has been there a little over a year and a half and really led the way in paving the partnership with Clearway Health and bringing specialty pharmacy as a service to the patients, providers, clinicians, and community that Lurie Children's Hospital serves. Rich, thank you for being with us today. Eric Balmier joins us from Children's National Hospital in Washington, D.C., where he has built not only the pharmacy and specialty pharmacy program, but now leads other ancillary services across the organization and has been a critical driver for the strategy and the growth of pharmacy, not just in the DC and the greater DC area, but really looking for ways to expand and innovate pediatric hospital and specialty pharmacy on behalf of Children's Hospital. And Nicole Fauché joins as the president of Clearway Health, where she will share experiences and perspectives as we have built specialty pharmacy partnerships with hospitals and health systems across the country. And so to all three of you, thank you for being here. Thank you for your time, and we'll jump in and get started. Our first question today, Eric, I'm going to start with you and really want to kind of center the audience and talk about the ways that pediatric hospitals are innovating and differentiating themselves. We have folks on this webinar who are independent children's hospitals. We have larger hospital health systems and IDNs who have children's services as a component of the health system. And so would love to hear from you your perspective on the strategies that you're leading at Children's National and how you're differentiating the services that you provide. We'll start with you.
All right, thanks, Allison, and good morning, good afternoon, everyone. I think, in today's times, our political volatility is such a challenge. You would think things are just changing day by day here, specifically here in the DMV, as you well know, being in the nation's capital. With the most recent legislation and executive orders, impacts on Medicaid, us hospitals losing money, I think it's really important that pediatric hospitals really take strategic opportunities to really broaden their business opportunities. We can't just do what we were doing in the past. We have to be different, we have to be new, and we have to be innovative. Us here in the DMV area at Children's National, we've taken our pharmacy to different levels. Just this year, we began looking at our employee prescriptions. We have approximately 9,000 employees here in our organization. And to my surprise, we actually spend close to $25 million in specialty drugs just on our employees and their dependents. So having an opportunity to offer NTM services whereby we can help change the definition of patient and allowing those prescriptions to be eligible for 340B pricing under the 340B program allows us to potentially save some significant dollars in those medications. So that's something new for us, and we're at the cusp of opening that service. But that's one example of how we're trying to be a little different and really think differently and being competitive and help manage some of the costs. Also, we were looking at bottom lines in every area. And when you think about that, opening the store and offering other services, travel clinic, vaccines, as the pediatric hospitals, not too many folks think about travel clinics in the summer for peds. So if we're able to offer that as another service to the pharmacy, that also helps increase and basically improves our competitiveness as a specialty pharmacy.
I appreciate those perspectives and the way that pharmacy centers many of those initiatives and strategies, but are so far reaching. Rich, let's come to you next and talk about the way that specialty pharmacy in very early days is transforming the work that you're leading at Lurie Children's Hospital.
Sure. Thanks, Allison. I think we have the same, we're all dealing with the same challenges that Eric did a nice job of outlining. In Chicago, we've got a few things that are probably a little different than many other markets. First is the pediatric marketplace is actually pretty fragmented here. So I think what you find in most large cities where there is a large children's hospital like Lurie, they are the most significant piece of the pediatric continuum by far. In Lurie, while we are the largest and I think most well-equipped provider in the Chicagoland area, we're not the only pediatric program there, and that has a lot to do with there being so many medical schools here. But for us, I think the headwinds that we're all feeling are really pushing the agenda to looking at cost and how we cut costs to be sustainable over the long term. But I think we want to caution ourselves not to focus so much on cost containment that we actually put ourselves out of business. So we're really trying to come up with a more balanced approach to growth. And the folks at Clearway know I've had some experience with specialty pharmacy and other organizations before I came to Lurie Children's. And what really sparked that earlier in my career was a slide I think McKinsey Consulting had put together that really did a nice job of laying out the profit pool across the healthcare value chain. So if you were to break the healthcare up into its different verticals, and this has changed a little bit over time, it's a slide they put together pretty frequently, it would show you that the provider space where hospitals, health systems, and physician practices sit, that we make up about 40% of the overall profitability of the healthcare continuum. And that tells me that while there is still room for us to grow in the particular lane that we're in, and we see opportunities to grow here locally, there are also opportunities for us to grow vertically. There's actually greater pools of profitability outside of the provider space that I think can become important for a program like ours that is so dependent on government-sponsored payment plans that are, I think, increasingly at risk. So I think finding ways to grow in our market is important, but it's also to start thinking about growing into other verticals, and that's where pharmacy comes in. I think for me that was, if you look at where the profit pooling sits, a lot of it sits in pharmaceutical manufacturing and in pharmacy services. So those are new avenues that we can bring our business into.
Thanks for those thoughts, Rich. You talked a lot about seeking sustainability, and I think it oftentimes without innovation becomes so much harder to do that with less. So, Nicole, your perspective here on the ways that we're innovating and certainly angles of specialty pharmacy tied into that.
Yeah, I think a lot of my thoughts echo or mirror both Eric and Rich's. I think we all broadly agree that pediatric hospitals tend to be at the forefront of care complexity and often find themselves working through that complexity with different or lesser tools than large adult focused systems. I think we see a shift in the pediatric hospitals looking at how do they own more of their value chain, and especially pharmacy is a leading example of that. And if I kind of expand a little bit further, the pediatric systems are trying to meet patients where they are. Rich mentioned this sort of fragmented system. We kind of look at it from the standpoint of like continuity of care to reduce that fragmentation. And so whether it's services in outpatient clinics, this idea of infusion transition or site of care transitions in terms of where care delivered, school-based services, cell and gene therapies. If you think about the patient journey and all that, it can be pretty fragmented when the value chain is distributed across the community. And so as we see pediatric hospitals innovating, it's a lot in this space. And then to Eric's point, the regulatory volatility, is sort of peaking, and I don't know how long that peaking will last, but it's certainly, there's a lot of unknowns involved, whether it's Medicare redesign, carve-outs, reduction in access that we're all going to experience. This will hit pediatric hospitals probably disproportionately in many ways. And especially pharmacy program, which what we're really focused on, provides a way to respond nimbly, and most importantly helps protect areas of margin and access for their patients that otherwise would be left to the community at large. And so we're heavily focused on how do we help pediatric hospitals innovate specifically through the lens of specialty pharmacy and the FDA pipeline that's coming through.
Cool, thanks. You talk a lot, especially for pediatric hospitals, and they're being poised to innovate and using specialty pharmacy as a way to do that. One of the things that we hear Eric and Rich and other hospitals and health systems talk about conversation within organizations about how to effectively grow and whether you're going to build, buy, or partner to do that. And so every organization certainly has different philosophical approaches on these things, and certainly different resources that may drive different needs. But would like for this group to talk about how you make those decisions. You know, as a strategic and executive leader, how are you choosing when to build, buy, or partner? Rich, we're going to start with you on this one.
Sure. I think that it's a really important decision for any major effort your organization undertakes. But I think you can make those decisions really hard, or you can take a fairly simple rubric to them, which has really been the way I try to think about things like that. And it has to do, I think, with four variables. And one is just how can I accomplish my goal the best? Is there a best way to move forward? Can I do this better on my own or with someone else? I think is a really important question. There's also the question of speed, which I think gets to another variable, which is organizational capacity. So if I start saying, do I have the bandwidth and the wherewithal to do this on my own, and can I do it as fast as I want to or not? And the last is from a cost standpoint. Is working together with someone else to stand something up or buy it the cheapest solution? And, you know, I think about just applying that rubric to thinking about something like specialty pharmacy, which I've had the chance to look at in a few other organizations before I joined Lurie. And I think I came to appreciate along the way just how complicated this part of the value chain is. So back to that, thinking about this rubric, when I start thinking about our organization's capacity and ability to do it quickly, those two reasons alone, I think, pointed us pretty quick down the path of saying that working together with someone was going to be most important to us. But I think it goes a little beyond just trying to pick a partner. I think it's also a matter of picking the right partner. And I want to just give a nod to Clearway Health on that front. I think we share, I think Clearway was born out of Boston Medical Center, which has a mission of service to the underserved that is very commonly the case for children's hospitals, which are so dependent on the Medicaid program. I think the last piece on partnership is really about making sure you pick the right one for the right reasons. And I think that's one reason I was excited and thankful that Clearway gave us the opportunity to chat today. I want to talk them up a little bit because I think they are the kind of organization that's easy for us to work with. And that certainly makes the transactional work a lot easier. So thank you.
You know, similar to Rich. Go ahead, Allison.
No, I was just going to say thank you. I echo the thanks back to Rich, but Eric, please continue.
So similar to Rich's statement, you know, and piggybacking off of what he just said, you know, having a subject matter expert in this space is essential. You know, it's too many competing priorities for leaders in the pharmacy space to really have now the time to dig deep into what it will take to be successful in this space. You know, organizations that have multiple departments, multiple locations, and in my case, multiple states. You know, I'm Washington, D.C., Maryland, and Virginia. You can imagine the importance of making sure we get it right. Each jurisdiction has a different set of rules for us to follow. So having a company like Clearway that has the subject matter expertise within each of these states, I think is one way you can guarantee success in this space. Now, the question that you mentioned here, whether to build, buy, or partner, that's, you know, some hospitals have both systems. They have hybrid. So you may have a specialty store in one location, and in your house you may have a regular pharmacy. So in that case, there's opportunities to have a hybrid situation, but nonetheless, both need that subject matter expert to basically be innovative and be successful in this pharmacy space.
Yes, Eric and Rich, thanks. You know, there's this idea of build, buy, and partner is kind of a universal question. I think we're all kind of asking ourselves this at a different point in time. In this space, one of the things I think about is you're trying to, it's sort of like entering an interstate on a ramp when traffic's going like 60 miles an hour, okay, like, or faster. Because what I mean by that is when you're building, especially a pharmacy discipline or service line, every day that you're not, you know, operationalizing a process or workflow or managing patients, you're missing an opportunity that you cannot get back later. And so we really talk about speed to value in that sense. You know, it's about the operations, and the complexity in specialty pharmacy is that there are some things that have to be sequential and there are some things that have to happen concurrently. And knowing and timing all of that is really important from the speed to value standpoint. I believe this number is pretty correct, that last year there was about 75 new drugs that were introduced by the FDA. That is not just about being able to capture those drugs, it's understanding them, educating providers, partnering with providers, understanding how the patients are going to respond. And that's at the same time you might be building just the capabilities within the specialty pharmacy operation in general. So, you know, there's parts of this that I think can be consumed internally, but without a partner, I believe that everything becomes more sequential and that speed to value takes a lot longer. And I believe that working with a partner in this space really creates a program that has long-term sustainability. And that's something that we talk a lot about. You're building an asset to serve the system in so many ways. And you want to make sure that we're not just kind of checking the box through like a project management list, but we're really creating a value-driving service line for the organization. So I think the key to this question ultimately is, do you understand the size of your market? Do you understand the complexity of getting there? And that's the very first step to understand, build, buy, or partner with somebody. And that's a tough question to answer for folks sometimes. And so we like to start there.
Nicole, you mentioned something and a question for this group that will tie in here. If there are questions, please add them in the chat. We'll leave them in or cover them at the end. But you mentioned understanding the size of the opportunity, and I think especially for a specialty pharmacy partnership, it is so data driven. And I know it's something that all three of us, have talked about over time. When we look at data and evaluate, oftentimes a hospital will say, well, we're doing really well in specialty pharmacy. We're achieving X million dollars a year, and it's X of what, and what is the opportunity loss if you don't make a decision to go today to really strengthen or move past the successes that you've already started to realize. And so a question for this group, Eric, you talk a lot about data. I'll start with you. What was the decision point when you understood the data where you said, this is a must-have, a no-brainer, we have to go today to start building this program?
Allison, it's one thing. We think we know data, and actually data is black and white. And the fact that it's just there, you really need to know how to carefully analyze and have prediction models that make sense for your area. When we first were introduced to this option and we were evaluating our data, and then when Clearway came on board and they helped us look at the data in such a different way, our opportunity was exponentially, bigger than what we've imagined. And then with the expertise that we're mentioning earlier about having those limited distribution drugs unlocked and really at the fingertips of your hand. I mean, one of the first things we did with Clearway was to establish a distribution center. We had an actual, we were able to overcome some of these manufactured blocks by building our own distribution center. And that was all through looking at the data and looking at the data from a subject matter expert's lens. The other thing that we had to consider is also the impact to our patients. In pediatrics, it is so difficult to manage a complex care case. We have kids here that are on 20, 30 medications. And when you're helping to navigate a parent that's treating a complex care child, you really feel bad. It's really about putting the parents at the center of that. Clearway's process involves implanting liaisons in clinics where these liaisons actually help navigate prior authorizations while folks are trying to get their prescriptions filled. So imagine being the parent of this complex care and having to deal with 4, 5, and sometimes even 6 different pharmacies to fill all these 6 drugs for that one case. Well, we have hundreds of these types of patients. So having, again, a company that knows this business, know how to navigate insurances, and can connect all of these the care under one roof. This is how we're able to manage and build and grow. So this type of strategy really helps build this type of business.
Thanks, Eric. I kind of want to dive on this data point for a second, Elsa, if you don't mind. I think there's some points that if I were to hey, what would be some key takeaways related to data? Understanding the opportunity in front of any hospital health system falls in a couple key buckets. One is understanding your provider's prescribing habits, number one, and that's based on specialties, number of docs, visits related to patients, et cetera. The second is, what are the behaviors of your patients? What is their first fill rate? What is their refill rate? How adherent are they to the drugs at the gate? What is their attrition like? How often do they start meds for a period of time and then choose to not fill at your pharmacy any longer, or not fill at all? How well do you understand when and how often treatment needs to be titrated or changed, or drugs discontinued and recontinued? I mean, there's all of these numbers that come into when you look at trying to understand the value of your prescribing habits in your patients in your market. And a lot of times people boil this down to say, well, do I understand leakage? And leakage is certainly an important metric, but leakage comes after you understand all of these other items, because the ways you sort of influence and improve sort of that part of the operation is really critical. So I think this is where, when you take your data, any individual data, and you might look at it in-house, there's an opportunity and a benefit to bump that data against people that are looking at this across multiple sites in multiple areas, right? Because your behavior patterns might be able to be influenced positively that impact clinical, financial, and operational outcomes. And I think that's where you really get a view of it. So when I talk about kind of understanding your community and the data, that's like the breadth and depth that I think is really important. And to your point, Eric, 100%, most of the times people's eyes get real wide when they understand how big that opportunity is with the right amount of focus and commitment to the strategy.
Nicole, thanks for that. I think it helps us to start inside out, looking at data and really what the opportunity is. This next question flips us a little bit into the external benefits and factors for patients, providers, communities. And, we talk so much in this context about the innovation and the growth for pediatric hospitals. At the same time, there's this concept of protect and defend as we continue to look at market share in ways that we're continuing to grow. And so, Nicole, let's stay with you to start and really set a foundation for what specialty pharmacy is outside in for communities and health systems.
Excellent. Yes. So let's take a quick level set for a second. So specialty pharmacy right now represents more than 50% of our national drug spend, and continuing to grow, right? The pipeline shows that we have more and more care shifting towards targeted therapies. We have the cell and gene that are incredibly expensive. We now have rare conditions that are chronic rare conditions that we are managing through specialty pharmacy. And so so the action here is, this isn't a spend issue, this is kind of a lifetime value issue, right? And so we're working through ways that we want to ensure adherence, education, affordability, access. These medications are not inherently open access drugs. And so there's work that has to be done with distributors, payer networks, all of which can be opened up with the right sort of alignment of goals with the different organizations. And so what we're kind of working through with this is like, how do we ensure that we can unlock as much of that value as possible? How do we improve the affordability of those medications for the patients? And then do we have a comprehensive model of support? I think in pediatrics, it's really interesting, right? Because you have patients that start very young, engaging with liaisons in this embedded space. They work through this sort of like transition of care planning or navigating payers and affordability, and just creating that within the entity, just drives a whole different sort of value. So specialty pharmacy at its core, to get to the main question, is the ability for health systems to take care of the highly complex, very expensive medications that usually have special means of administration. And so those are not your typical retail drugs. And so this again ties into like, how do we design, implement, and strategize around this very special set of medications that are becoming more and more common in use.
Cool, thank you. Eric, you mentioned when you started the difference in talking about a retail and a specialty pharmacy, and talking about the ways that organizations may enter this differently. Your perspective is unique because you had a retail pharmacy on campus and you were looking for ways to say, hey, these scripts are going somewhere. They are up for grabs. How can Children's National better serve our patients with our own services? So tell us a little bit about what that looks like from your lens.
Yeah, thanks, Allison. I think two big points. I think the first point, having a pediatric trained specialist at the store is a game changer. You have a pediatric pharmacist who not only has access to your EMR, who really facilitates transitions of care at the store, where you really minimize errors, but just having that expertise for precision dosing and so forth really makes us stand apart, and really is a big benefit, not only for just the patients, but also the providers. Providers can talk, you get to meet the provider, you get to have telepharmacy with these pharmacists. I think it really helps us stand us apart from the other stores. The second point I want to bring up, and I don't know how many of you have this or know this knowledge, but if you take a look inside your clinics and your ambulatory care services, the folks that are doing the prior authorization work, they all vary, and they are all at different levels of expertise in that space. I think having some of that work, again, done by expertise, subject matter experts, even the folks at the store, really helps us, allows us to speak pediatrics to these healthcare plans. A lot of times you're getting barriers of hey, send the child into home care, or send the child somewhere else, versus having that child referred back to the hospital clinic for an infusion, for example. Having those opportunities where pediatric trained specialists can talk the clinical aspects of the care to the payers also is an advantage to the provider, to the patient. It facilitates the care. It expedites folks having appointments. I mean, it's really a whole service that we're able to do with that specialized care at the store.
Eric, I appreciate that. And I think having that component as a differentiator, especially for pediatric hospitals, is an important one to consider. Will you take your comments just a step further and talk a little bit about the benefit that specially trained pharmacists in that space, providing care to patients and supporting clinicians, providers? Will you talk about the impact, especially for complex care patients and their families in the pediatric setting?
Sure. So similar to the example I gave earlier, a family with a special needs child with 25 to 30 medications, having a pediatric trained specialist allows us to really bring in the care, really bring in the pharmacotherapy care that's required. You're able to bring in the patients, space out the dosing, prepare the med boxes. I mean, there are things that happen in those cases. Some of these children go to school, so you're managing school-based services along that with a special needs child. It's a wraparound service opportunity that we have when you have this specialized trained pharmacist that can really do all of those things at once. Imagine a mom with one child like that or multiple children like that. We're able to provide and close the gap on all the issues that surround and problems that surround giving care to these special needs kids.
Yeah, thank you. Thanks for additional follow on there. Rich, let's come to you from your perspective at Lurie Children's Hospital. You are now for the first time introducing ambulatory pharmacy services outside of the inpatient care setting. Talk to us a little bit about what that looks like and how it benefits the organization.
Sure, glad to. I think having said that I've had some experience with specialty pharmacy and other organizations before I came here, this has been on my agenda since the very beginning. When my CEO asked me about where to what I might want to focus on first before I actually began, the specialty pharmacy was top of bracket, and it has everything to do with the value it can bring to the organization. And I want to really talk about our people. So if you were to say what is the thing that makes any healthcare institution great, it's its people, and I think that's especially true for pediatrics. So when we start thinking about the value of that network and the way in which that value is recognized by the marketplace, I think we do see disproportionately large payments coming from Medicaid, which often doesn't cover costs fully. And that's not a knock at Medicaid. I think that's just the reality of the situation we find ourselves in. So we have payers that don't cover the costs fully. We also have challenges that sometimes certain specialties are reimbursed differently. And when I think about that, I think about programs like endocrinology, pulmonology, genetics, rheumatology. These are essential specialties for the care of any patient, but especially children. And when you look at the way those services are reimbursed, even on the commercial side of the world, that those payments don't often cover the cost of providing that care. And I think that when you start thinking about what specialty pharmacy can do, it gives you another way to handle the shortfall of hospital reimbursements. It gives you another revenue stream, an opportunity to support and reinvest in your providers. I think the other thing it does is it unlocks some profit pools that make more investments in essential programs like endocrinology easier to contemplate, because the profit pool for endocrinology is deeper in some ways in the pharma space than it is in the provider space. So it unlocks a way to think about investing differently in programs that often serve children that don't cover themselves, either because of the payer or because of the particular program. So I think that's one. And building on what Eric was saying earlier, talking about the complexity of children. When you look at pediatrics, I think we all see the same statistics around declines in fertility and what that means and looks like. But what they don't understand is that while the number of children may be declining, the number of children with complex conditions is increasing. And so what we're seeing is more demand for these really complicated children, which specialty pharmaceuticals are changing their lives. So our ability to have access to those drugs, and as Nicole was saying, it's not just the access to the drugs, really having the clarity around what the uptake of them is, whether or not they're actually conforming to the treatment plan. We have now a visibility into that side of the business that we just didn't have before. And so I think it helps us fund what we need to fund in order to take care of kids, but it also allows us to take care of them better. And I think that's true for everyone.
Rich, your comments tying into taking care of them better. We have a question that came in from one of our attendees today, a comment and a question. The comment was, hey, I'm actually a parent of a pediatric transplant recipient. And so someone who has experienced on the other side as a parent, the kind of impact that these drugs and these types of services can make. The question associated with that is, how are families involved in this process, especially in a pediatric care setting where we have, parents in addition to other caregivers. Nicole, I want to come to you as a follow-on here. We certainly have a lot of engagement measures when we think about patient satisfaction. We think about, the surveys, the ongoing touch points between team members and the patients and their families. Will you talk a little bit about that involvement and the importance of it as we design these strategies?
Yes, definitely. I'm going to start a bit with a story first, if that's all right, because I think the trust that's built through these programs between the parents, the children, the organization helps explain how we engage and why their feedback really is helpful. So this is a bit of an older story, but we were working with one of our clients in their pediatric offices, and we were, speaking with this parent pretty routinely, and we noticed that some of the adherence related to asthma treatment wasn't really being, it just wasn't the adherence just wasn't matching what we expected. And despite some conversations, it took a little while, but what we found out was that the cost of the medications and the history from this patient and this mom was that she was rationing the nebulizer and the asthma treatment between two children, and that had gone unknown for quite some time. And through some discussions, what we found out is that they just weren't aware that there's an opportunity for affordability. And through some questions and ongoing connection, what we're able to do is provide a path so there's affordability, and both of these children received the care that they needed without concern related to the cost for the family. The reason I bring that up is that there's a really important metric, which is that patients may see their providers once a year, a couple times a year, maybe not even once a year, depending on more on the adult side, but they will talk to their pharmacy or their pharmacist at least once every month, if not multiple times. So that relationship is really deep and you learn a lot. So we learn a lot from the standpoint of surveys and feedback, and we engage parents, we take that feedback and families very seriously. But just the ongoing, interaction with these patients and families creates a redesign for us constantly related to the program and how we make sure that we're bringing forth some of these items. So we do patient satisfaction surveys. We do engage them related to design. Our client partners have various ways that they incorporate patients into the design of their service lines and feedback, and we use that as well. But I will say the strongest part of this has been the ongoing feedback we get from the providers and the patients directly in one-to-one interactions that help us really shape and hone in on those things that are most important, because each community is a little bit different. And so it's an important part of the design at each site.
Cool, thanks. And thank you for the question to the audience here. We've talked a lot about specialty pharmacy. It is certainly one of, but not the only space where children's hospitals are looking to grow in the outpatient care setting. And so when we think about traditionally inpatient service lines like pharmacy, there are others, oncology, infusion. There are many others that hospitals are looking to the outpatient space to really expand access, to really drive some of the access and services in the community. So would love to hear from each of you how you're doing that and what some of your strategies are, including but not limited to specialty pharmacy. And Rich, we'll start with you on this one.
Great, thanks, Allison. I think Lurie Children's, if you're not familiar with it, went through a really significant inpatient expansion about 12, 13 years ago. It moved from being about 120, 130 bed hospital up in Lincoln Park, an inline suburb of Chicago, to moving downtown and becoming about 3 times the size it was. So there's been a lot of time and effort and money that's gone into building out the larger, more robust inpatient enterprise. As where that investment leads off, though, is really around our ambulatory sites. So when we have a new ambulatory location opening up in the northwest suburbs of Chicago and Schaumburg later this month. And as you were talking about oncology, we're excited that that will include an infusion program. So for, Chicago is a big city. And when we start thinking about the kids that we're servicing in places like the northwest suburbs of the city, it can take you every bit of an hour and 20 minutes to get downtown to our main campus. So we're excited to be able to bring more of those services out to the community. At the same time, we're going to be making a pretty significant reinvestment in our ambulatory business over the next few years. Our two largest sites our two largest ambulatory sites, the existing sites, are also two of our oldest locations. And I think when we start looking at them and what's around them, we have, as a lot of health systems have, acquired different programs and practices. And what we've got is this sprinkling of little things across a very large market. And I think what families find most valuable, especially families of these complex children that need a lot of different kinds of service, co-locating them all together into larger branded destination facilities that can serve a greater set of needs is really important. And now we've got the added pressure that the hospital downtown is doing really well. It's grown a lot, but we now are finding ourselves compressed with some lower acuity kids that we can serve better out in the community. So for us, I think we're viewing the ambulatory expansion not just as just simply growing more outpatient clinics, but we're also seeing the opportunity to start taking care of more ancillary and support services outside of the hospital and bring that closer to home.
Rich, thanks. Eric, let's come to you and hear your perspective on some of these ambulatory strategies for growth at Children's National.
Yeah, Allison, similar to Rich and Lurie Children, I mean, healthcare is shifting. It's shifting to a more ambulatory space. And I think, as far as access, which is what Rich was alluding to, you want to make sure you get care to the areas that most needed, that folks most need it. And so lots of strategies are happening around making sure that if they can't come to us, we get to go to them. And in that vein, Children's National here, we are partnering with our travel clinics. So we have a huge mobile van, and we actually have several. We have a blood drive van, and of course, lab happens to report to me. So now I'm trying to merge this sort of service, give blood and get your medication therapeutic management consult while you're at it. So just having that opportunity to bring pharmacy services to the community is one thing that we're doing. The second thing for us is camp support. This year we had the opportunity to support our campers. Children's National hosts a disease-based camp for those kids. So every week we get a different disease state and kids going to a particular camp. Well, we've embedded our pharmacists at the intake process to help make sure the campers and the nurses that are at the camp have the right medications for those campers. Well, any gaps in care, they're able to utilize our specialty pharmacy to help fix and really have the kids, allow the kids to have a positive experience at the camp. I mentioned school-based services. Children's National has approximately 300 schools across the DMV that we service. So it's our nursing teams that are there, but oftentimes, especially in a special needs school where there are lots of medications that are part of the school day, we partner with those schools and we partner with those school nurses to help bring that experience. And then lastly, with the mobile vans, as I said earlier, the travel clinics and vaccine clinics that we offer, sometimes you meet parents and children that don't have a primary care physician. So we have the ability to almost, I'll call it a reverse referral, where we're actually the first point of contact of a family to actually interact with one of our pediatricians under Children's National Hospital. So we're able to refer back to the hospital and to primary care families that don't have primary care doctors. So there are lots of opportunities for us to sort of, again, close the gap, the healthcare gap in this space.
Great, Nicole. You have heard both Eric and Rich talk about really increasing access to meet the community to provide services where they need it. Will you share perspectives on not just specialty, but other areas where you see this going?
Yeah, I always get excited when Eric's talking because he kind of just like has this like energy about it. Like, I don't know how many people get as excited about travel clinics and mobile, but we get rallied around it. So Eric, thanks for that. But I would say this, like, specialty pharmacy by definition is an ambulatory outpatient service, right? Specialty pharmacy is not something that is really inpatient discussion. And so as outpatient strategies expand, whether it's new specialty or subspecialty providers, new locations, expanding different communities, specialty pharmacy is an anchoring point, and it's an important part of probably the overall due diligence and evaluation. We hear constantly for a very long time that care is moving outside the hospital or more at the edges of our outpatient system. But the one thing I do want to kind of pull in here that's tied to this is that the payer dynamics drive a lot of this movement, right? When you're looking at hospital-based infusions, provider-based infusions, home-based infusions, site of care, like how do you get ahead of that, both for what's best for your system, what's best for the patient from a clinical and appropriateness standpoint, and what's best related to the payer affordability standpoint. You start bringing all that together and you start seeing areas that are both, I think, opportunities for innovation, but also places where you can get ahead of what the curve is causing already happen, just the trending. One thing we've been a little silent on during this conversation, but is really important, is that for pediatric hospitals, like many other like disproportionate share, 340B opportunity is really important. And understanding how that contributes to the strategy and the planning is a very important lever related to how you kind of innovate and expand outpatient services specifically for specialties and specialty pharmacy. So I would be remiss if we did not bring that into the importance of that program, not both in terms of serving patients, but also, as we said throughout this call, when pediatric hospitals are often asked to do more and more with a little bit less, this program helps provide some financial contribution and stability to those programs, which is really needed in the communities.
Thank you all for that. We're nearing about a 10-minute mark and want to spend the balance of our time really thinking about calls to action and I think a lot of thoughtful and intentional approaches to growth in this conversation. As folks leave the webinar today, what is your advice for places who are looking to innovate and differentiate in new ways? Would love to hear from each of you things that you're thinking about, advice that you may have, and Eric, we'll start with you.
Thanks, Allison. I think a few things. Being a subject matter expert is important, but also knowing when to ask for help. And in this space, I think there's enough out there, companies like Clearway, who can really take burdens off of pharmacy leadership. In hospitals, the margins, pharmacies play a big role in that bottom line margin and basically the viability of organizations. And I think having a partner that can really help sustain the margins that you're able to bring in with a specialty pharmacy is really important. The second thing, Nicole touched on it a little bit. 340B is, again, you probably need your own PhD degree on 340B. It is complex. It's just really staying ahead of all the changes and also understanding where the manufacturers land. We really need to pay attention and really need to advocate for 340B. It would be tragic for hospitals to lose their 340B opportunities. And I think we all need to really be experts in that space to make sure we can maximize the growth there. So I think those two things, I think, is what I would like to leave the audience with today.
Thank you. Nicole?
I would say a piece of advice would be, if pharmacy has historically been seen as a cost center, you need to sort of figure out how to forget that altogether. Don't think of it as cost savings. Don't think of drug costs as a limiting factor to growth, and instead think about pharmacy as a revenue enhancing opportunity for your organization and one that will stabilize your bottom line. Again, it is a game-changing way to look at it. Think of pharmacy, and especially pharmacy, as a platform for stability and growth, which is very important. And then lastly, I have appreciated Rich and Eric's comments throughout this conversation, but the power of a redesigned partnership is somewhat limitless when you start bringing together pharmacy, clinical operations, your financial teams, your patient clearance teams. I mean, we're improving outcomes, like building massive trust with patients, your system's growing faster. And so I think the idea of a redesigned partnership, which is what we celebrate all the time, is really important. So don't think cost center, and think partnership.
To your thoughts?
Great, thanks. And just kind of building on that, I think I really appreciated the collaborative nature of working through what a relationship with Clearway could look like. And it reminded me of something, talking to Nicole. Just I really appreciate, Nicole, the way you talk today. It's very emblematic of the way I think you work and think. And it's a good reminder to me that it's so easy in times like these where really things feel like they're on fire, that you can just zone in and look really narrow and tight at things. But really, I think for all of us that are trying to thrive in a future that's got this kind of uncertainty, I think making sure that you give yourself the headspace to step back and broaden your aperture and look more broadly at what the opportunities could be. And that means stepping out of the fire for a few minutes and looking at the broader sweep of the business. And to me, that's where I start opening my mind to things like vertical growth. And so I think making sure that even in these really tough moments, you're giving yourself the headspace to think bigger and broader, not just narrowing in. And I think it's also a matter of being very discerning about where and how you choose to spend that time. There are a lot of different ways we can all grow. And I think the approach to sprinkling your time and energy across those things is I think, especially now, very dilutive. So I think thinking broader and being more intentional are probably more important now than they've been in a very long time.
Rich, thank you. Thank you for that. I think the discernment and intentionality is certainly a critical component of getting started. With a few minutes left, there are a few other questions that we haven't gotten to yet that would like to offer to the panel here. One of them is asking about the successes between adult specialty pharmacy services and children's specialty pharmacy services, certainly in IDNs where both of those services coexist. Rich, you've recently come from organizations that serve both. Nicole certainly have experience in building and leading programs across organizations who have both. Rich, I'll start with you on kind of your feedback on what this coexistence and successes have looked like in that kind of environment.
I think thanks, Allison. I think it's true, but in some ways, my experience has really been either with adults or with children. Phoenix Children's is an independent freestanding children's hospital, and in Ohio, I think the relationship that we had at Ohio Health with Nationwide Children's was very collaborative. So I think what I have seen being effective and important is really the transition of patients as we start thinking about patients aging out of the pediatric program. I think the importance of getting the specialty pharmacy connection kind of reestablished with the adult provider and making sure that is as seamless as it can be for the patient is really important. But I've not had the experience of actually working on both together.
I think that this is such an interesting topic, because when we're talking with our Flurry Children's National, there's ways that adult medicine sort of touches, but certainly isn't the focus. But one of the interesting areas when we talk about transitions of care, what we're thinking about are patients that are moving from pediatric care into adult medicine. And that is a very important part of this. And so having that experience across both sides is really critical because like that, it is about the patient, which is the center of really what we're talking about. We have existed in places and supported organizations that have a very strong pediatric base within a predominantly adult system. We've also worked with organizations like OU Health that have a children's hospital within the system. And what's really important is there are like the operation of the pharmacy has a lot of what I would say is like sort of scalability to do that. But the liaisons and the patient management support is dramatically different still for all the reasons that Eric and Rich have mentioned. Like we do have to take care of pediatric patients differently than we take care of adult patients in specialty pharmacy, and we have to do that. And then even recently we worked, and I find this to be a really kind of rewarding part of this is we, in pediatrics, one of the large patient populations is cystic fibrosis patients. We find ourselves today working in an organization that I think is probably one of the largest adult cystic fibrosis programs I have been aligned with. And we've got to see this, patients moving from the pediatric side into the adult side. And that's a kind of a testament actually to specialty pharmacy in and of itself, that we're seeing cystic fibrosis patients in the adult medicine side for such a long period of time. So you start thinking about how these patients are managed, and I think bringing those together is an absolute opportunity for maturing and supporting both types of patient cohorts.
Thank you both for thoughts on that. We have, there are some questions that have come in. There's things, asking questions about really perspectives on drug cost and how that will impact specialty pharmacy services. Things talking about alignment of wholesalers and moving from inpatient wholesaler agreements and how those are built and structured in an outpatient retail and specialty pharmacy setting. With 2 minutes, we will not be able to answer those and other ones, but we certainly do commit to providing follow-ups, the recording along with information for this panel so that you can certainly reach out and follow up. And know that Clearway Health is eager to be a resource to you as you navigate what your specialty pharmacy strategy may look like, whether you're just getting started or looking to accelerate it and capture that last little bit of opportunity and service that you haven't been able to reach. But today we are grateful for your time. Rich and Eric, thank you for your partnership. Thank you for sharing your voice and your experience with us. And to the audience, thank you for joining us today. I hope you have a great afternoon. Take care.
Thank you.
Thank you.